Welcome to the channel Nursing in Handy. This channel is preferably for all the nursing fraternities to have a continuous learning in their profession. So today we'll be discussing about prevention of accidents in children. So before proceeding into the topic, we must know why we have to consider this topic as very essential, because the accident is one of the major cause for mortality and morbidity in the pediatric population. Since the pediatric populations are very excited and they have a behavior of exploratory, and they also need and also lack of information regarding the motor vehicle accidents. So due to their small size, we end up with the accidents in children. So we can prevent some of the accidents in children if we are following some of the preventive measures from the medical side. So as a nurses, we are responsible for imparting the knowledge to the caregivers who seek the medical intervention from the hospitals. So we can give them information regarding prevention of accidents in children. So there are various accidents in children like motor vehicle accidents, aspirations, or foreign body aspirations, choking, like that. So we will be seeing in detail one by one. So the main concept of this preventive pediatrics is improving child health, that is the health maintenance. So whatever the healthy lifestyle they are following, we have to promote them by having a health maintenance. Next is preventive health. So preventive health means, so we have come across one of the famous proverb, that is prevention is better than cure. So before occurrence of any condition, we can just opt some preventive measures so that major complications can be prevented, like nutrition, sleep improvement, and lifestyle modifications, and improvement in the sedentary lifestyle. So increase in their physical activity. So these all are the some of the preventive measures to improve the health status of the pediatric population. So when we consider about the accidents in children, we can teach them traffic rules, and we can also encourage the parents to have extra care on the children during their outings, or during their visit to the hospitals, schools, wherever, and also close monitoring of the children in the homes, like that. Next is the major causes of death during the infancy and childhood. These represents death rate of the ages between 1 to 14 years per 100,000 populations. So from this list, it is very clear that the accident is on the topmost criteria of concerning the major morbidity and mortality increase in pediatric population. So next is congenital abnormalities, cancer, homicide, heart disease, pneumonia and influenza, suicide, human immunodeficiency disease. So these all are some of the causes for having the increased infancy and childhood mortality rate. So next is injuries. So injuries are a major cause of death in children. So injuries are the major cause of death during infancy, especially for children 6 to 12 months old. All children are at risk for injury because of their normal curiosity, impulsiveness behavior, and desire to master new skills. So they have a behavior of exploring new things. So when they do these activities, they may end up with any injuries. Next, we will be seeing about the safety risk in terms of developmental stages. For each and every stage, there are some of the risk factors. So in infant, the majority of the causes in the accident is motor vehicle accidents, infections, dehydration occurs in the infancy period, and respiratory problems due to the low immune power, child abuse. Next, in toddler, same. Due to the over curiosity behavior, they may end up with the motor vehicle accidents, toddler fracture, poisoning, foreign body airway obstruction, asthma, croup syndrome, respiratory problems, vomiting, dehydration, and same child abuse. So toddlers are very prone to poisoning because they will be very eager in exploring new things. So they may end up with the poisoning thinking that it is a juice or any edible substances. So in that way, they are we can see in hospitals majority of the toddlers we end up with the poisoning cases. Also foreign body airway obstruction. So they will be playing with the small toys and batteries. Sometimes it is they may just swallow those batteries. Next is in preschooler, again motor vehicle accidents. When they are riding the bicycles, it may end up with the motor vehicle accidents. Trauma, again poisoning, asthma, respiratory infections, drowning and child abuse. So drowning means if the babies are going into the restrooms and there is a water being filled in the buckets, they may end up in the drowning. So due to their small size, they go for drowning. Next, in school age, again motor vehicle accidents, that is they will be a pedestrian rider. Next is sport injuries. During their play in the school activities or nearby the homes, they can end up with the sport injuries. Next is in adolescent age group, we have a trauma, again motor vehicle accidents, knife and gunshot wounds, pregnancy complications in case of teenage, suicide, again poisoning and child abuse. Next is common safety problems. So injury prevention measures for these all conditions, these all accidents, we are going to see in detail the preventive measures. So why? Because we are going to see the aspiration, motor vehicle accidents, burns, drowning, bodily injury or fracture and poisoning. So for each and every problems, you are going to see the preventive measures and what does it actually mean. So aspiration. So asphyxiated by foreign material in respiratory tract is leading cause of fatal injury in children under 1 year of age. Puts everything in mouth. So you can see infancy. The infancy period starts from exactly if we have to tell means from 1 month to 1 year. So during that period, they have a tremendous increase in the fine motor skills and the gross motor skills. So what happens is whatever they are finding in the floor, that is a small things like their toys material, small toys is there, or any food particles which is very small in size, if it is there, they will use their fingers to just grasp those and put it in their mouth. Next is, what are the preventive measures is like carefully inspect the toys for potential danger and removable parts, keep the small objects out of reach of children, and do not feed hard candies, nuts, food with pits or seeds, circular pieces of hot dogs. Hold the infant for feeding, that is in upright position you have to hold while feeding the baby. Next is use pacifier with one piece construction and loop handle. So these are some of the measures for preventive measures for aspiration. So during the 8 month of age we will be introducing the finger food. No, for that time you have to not give full wholly nuts and all, you should not give, so that if they are in taking the whole nuts means that will go and have a choking problem and may end up with the aspiration. The same way you have to carefully watch the toys what they are playing with. If there is a small parts in that toys, they will put that small parts in the mouth and may end up with the choking. So these all are the some of the preventive measures. These all can be prevented. These aspirations can be prevented. So these all are the preventive measures. In the same way, during the feed also, you as a caregiver, you have to sit along with the babies and you have to assist in feeding. You have to encourage the baby to have their self-feed, but at the same time, the caregivers has to sit beside of the children and ask them to have the feed. That is the preventive measures for aspirations. Next is motor vehicle accident. So vehicles like children improperly restrained, and if they are riding as a pedestrian rider, like they will be just running, walking, especially after the objects thrown into the streets, poor perception of speed, lack of experience to foresee the danger, able to open the doors and gates and get outside. Children often unseen because of small size can be run over by car backing out of drive, ride toys, bikes in path of danger. So it means that due to their small size, if they are playing in the back side of any vehicle, if a person who is driving the vehicle is just having a reverse gear, so due to their small size, it is not visible for the driver to see them, so they may hit the children's during that period of time. And in the same way, when the baby is being taken to the outer environment like parks or in the roadside, the baby will be running. So what happens that time, if a car or any vehicle which is coming in a high speed may hit up the children. And in the same way, inside the home there is a doors. if a baby is able to open the door and go out, can also end up with the accidents. So how we can prevent is, use federally approved car restraints, supervise the child while playing outside, do not allow playing behind cars, supervise riding of toys and bikes, lock the fences, gates, doors, teach to obey the pedestrian safety rules. So from the childhood itself, we have to teach them the traffic rules and also to obey the pedestrian safety rules. So that means they should not run in the roads, or as a caregiver we have to be very careful and have a close watch while taking the babies outside. So these all are the some of the measures to prevent the motor vehicle accidents. So next we will be seeing about the burns. So in case of burns, the childs are inquisitive and will pull pots of stove, place matches, insert the objects into wall sockets. They can climb, reaches the stove or oven, ironing board and iron secrets on table. Next is unaware of sources of heat or fire. So if for a small kid, if you are telling that the fire will burn, you will have a burning sensation, the baby will not able to identify because they do not have the experience of burn. But whereas once they go and get experience by touching that burn only, they will come to know, okay, it is hurting me, like that. So in the same way, the babies will not have experience of burns, and due to their curiosity, they will go and catch all the utensil is being placed in the gas stoves or the ironing tables, everything. So what are the preventive measures for burns? So turn pot handles toward back of stove, that is opposite side of the stove. We have to place the handle of the any utensils. Place the guardrails in front of the radiators or fireplaces or any stoves. Store lighters and matches in locked container. Cover the electrical outlet with protective covers. Keep the electrical cords hidden. And check the bath water. Do not allow the child to play with the faucet. So when we are just using the water heater in the restrooms during the bath, so what happens, the baby will go and open the tap and may end up with the burns, that is minor burns like blister formation may occur. So in order to prevent that, you have to lock the doors of the restroom, and wherever the fire is being there, like in kitchen side or in the restroom sides or in the garden side, we have to make the babies not going out of those areas. These are the some of the preventive measures of burns. And even in the restroom, you have to prevent the babies using the faucets and playing with those faucets. So if you are being switching on the water heater for bathing, so what happens, that water will be coming out from the faucets. So if you are using the faucets, that may end up with the burns. So next is drowning. So for what reasons the baby may go for drowning is, the child does not recognize the danger of water. So unaware of inability to breathe the underwater. Next, has a very curious about water, and one of the major concern when the baby is going into drowning is hypoxia, that is the low concentration of oxygen. And due to the small size, for example, the water is being filled up in the bucket in the restrooms. So due to the small size, what happens, the baby is playing in the filled water. Suddenly the baby will go into the bucket water. What happens is, the bucket will be acting as a swimming pool to the baby. So the baby may go into drowning state. Next is how we can prevent this drowning is, fence around the pools, have a self-locking gate. Supervise when near water sources. Keep the bathroom doors closed and toilet seat down. Teach the swimmings and water safety to the children. If they are able to understand the water safety measures, and from the small age, you can also teach them swimming to the children. And the same way, whenever the baby is going near the water sources, as a caregiver, you have to supervise as whenever it is needed. Next is bodily harm, that is fractures. So the babies will be very curious and very enjoying while climbing the trees or wherever they needed. So they used to climb, run and jump. So and in the same way, the baby who is growing have growing of their fine motor and gross motor skills and milestones. So there will be, even though they are having those development, they will be having some imbalances that may end up with a fracture. and able to open the doors and windows. While doing the opening and closing of the doors also, there will be a bashing of their legs and extremities. Next is poor depth of injuries. Next is how we can do the preventive measure is keep screens in the windows and locks, place gates at top and bottom of stairs, apply a non-skid decals in bathtub or shower, remove the unsecured rugs, scatter rugs, never leave the unattended in shopping cart, avoid giving sharp or pointed objects, do not allow the lollipops in mouth when running. So these all are the bodily harms preventive measure. Next is poisoning. So poisoning is one of the major cause of the infants or the children's morbidity and mortality rate. So why we have to consider this poisoning is because as a caregiver we will be very much we have to ensure that the baby is not touching all the chemicals being used in the homes. For example, the mother is being filling those toilet dispensaries or toilet cleaners in any some other bottles like juice bottles or any other cool drinks bottles. So baby will think that that is something which is edible or something which is being we can drink. So in that way the baby drinks those and end up with the poisoning. So the major toxic agent is common during the early childhood, that is between from the infancy to the preschooler. This is the reason for poisoning. So there is improper storage, and we have to maintain that the proper reach of the poisoning agent should not be there for the children. And the same way the babies cannot read the labels, so they do not know what is the thing which is being eaten and what is harmful chemical. So they do not have that much development to distinguish between the edible substance and the harmful substances. Next is developing the fine motor skills, that is able to open the bottles. They will be very curious in opening the bottles and just drinking it. So sources of poisoning is like cosmetic products, personal care products, household cleaners like soaps and polishers, plants, even the drugs that is being taken by the grandmothers or grandfathers or the family members, insecticides which is being used in the homes can be ingested by the children's. Next is hydrocarbons, that is gasolines, that can be either inhaled by the babies, that are also the poisonous. Therapeutic interventions like a poisoning may or may not require emergency intervention, but all should have a medical attention. Parents are advised to call the poison control center before initiating any intervention. So assess the child, treat the child first, not the poison. So take the vital signs, assess the airway, breathing and circulations, maintain the respiratory functions, provide a ventilatory and oxygen support if needed, start IV infusion, draw blood for toxicology screen, apply cardiac monitor, initiate measure to reduce effects of shock if applicable. As soon as possible we have to treat the child by the medical protocols. So first we have to treat the child, not the poison. So we have to ensure the baby's airway is being cleared, breathing is normal, circulation is there or not, like that we have to provide. And as soon as possible we have to provide a ventilatory support and oxygen support if needed. So next is remove the child from the exposure. So empty out the mouth of any pills, plants or other material. Flush eyes with the tap water. If being splashed on their eyes means we have to flush the eyes with tap water. Flush skin and wash with soap. Bring child of inhalation poison into fresh air. In case of inhalation poisons like gasolines, we have to bring that child from the exposed area to the fresh air to breathe. So that is the removal of child from the exposure. Next is identify the poison. So question the child and witness. Try to find out if only single product ingested. Look around the environment for clues. Do the products ingested break down to other substances? Find out the mouth ingested. Amounts that can cause concern is like from 1.5 years to 3 years old. If a baby is being consumed 4.5 ml, we have to immediately shift the baby to the hospital. So next is therapeutic interventions, that is give activated charcoal orally to drink a solution, and you have to cover it and give to in order to prevent the baby seeing that black color, and give through a gastric fluid. Next is do not induce vomiting if the baby is having lethargic, coma, seizure, and has an absent gag reflex. So patient ingested an unidentified material, a corrosive substance or petroleum product. In that cases, you should not induce any vomiting. So insert the gastric tube and perform gastric lavage with a normal saline once airway is protected with a cuffed endotracheal tube. So place the child in a side-lying position to decrease the chance of aspiration. So far we have discussed about some of the accidents being caused in the children's population. So like aspiration, motor vehicle accidents, and foreign body aspirations. So these are some of the causes of accidents in the children due to either caregivers ignorance or due to the over excitement of the children, that is over exploratory behavior of the children. So something which can be prevented is accidents. So some of the measures and preventive measures has to be carried out, and as a medical health workers we have to educate the population regarding the preventive measures of accidents, because accident is one of the major cause of child's morbidity and mortality rate. So this all we have discussed about the accident prevention in children. So if you have any doubt, kindly drop down in the comment box. Kindly subscribe it, like it, share it and follow it. Thank you for watching.